Happy evening, viewers. Welcome to yet another episode of GarbhaSandesha, episode number 33. And today's topic, as requested by our audience earlier, will be talking about how does PCOS or PCOD affect women. To talk about this topic, we have with us Dr. Anita Manoj and Dr. Jahnavi Asankula. Dr. Anita has over a decade of experience as a gynecologist. She specializes in infertility and holds a fellowship in reproductive medicine from Rajiv Gandhi University of Health Sciences. She is one of the best fertility experts in Bangalore and practices at Garbhagudi IVF Center at Nagar. She is a member of FOXI and Indian Medical Association. Dr. Jahnavi Asankula is a diligent and dedicated fertility expert practicing at Garbhagudi IVF Center, Electronic City, with sound knowledge in gynecology, obstetrics, and infertility. Dr. Jahnavi holds a fellowship in reproductive medicine from Bangalore and has co-authored several papers published in international journals. She is known for her approachable nature and immense dedication to her profession. Viewers, let me remind you that as we start this month, we have free first infertility consultation at all our centers in Bangalore. Please do avail that. And now I would ask both the doctors their initial take on today's subject. How does PCOS and PCOD affect women? I'll start with Dr. Anita A. Manoj. Madam, please.
Yes, sir. Happy evening, everyone. I'm Dr. Anita. Today, this is one of the most common problem in the society, that is the PCOD. Many people walking into the OPD, like daily, if 10 patients are walking into infertility OPD, around 8 patients amongst them will be having this problem, PCOD problem. That means they will come with either, say, irregular cycles, not able to menstruate regularly, or having weight gain, excessive weight gain, not able to conceive, like delay in conception, subfertility or infertility. So these problems, and few people will visit the dermatology department also, like younger people, they will visit saying oily skin, loss of hair, excessive acne. So all these complaints will be there for them. To gynecology with menstrual complaints, and to the fertility with the subfertility or infertility. So when we do evaluate all these people, most of them will find out to be like PCOD, that is excessive follicles in the ovaries. Like normally there should be around 8 to 10 follicles in each ovary, that around roughly 8 to 10 follicles in each ovary. From this, naturally one will be selected as egg and it will grow, and one egg will be released every month from either the right or left ovary for a girl or a woman. So if there is so much of like excessive, more than 15 in either of the ovaries, then this condition, we call it as polycystic ovaries, ovaries. So when this is there, these girls, they won't be able to menstruate, they won't be able to release the eggs naturally, ovulate. They need some medical help. And because of this anovulation, that is not able to ovulate, they will go for hormonal imbalances, the first step. So this hormonal imbalances causes irregular cycles. So when this condition is not treated or addressed, this will lead to some other metabolic changes in the body. So that is weight gain or stress leading to polycystic ovaries, and polycystic ovaries leading to again weight gain and again metabolic changes, hormonal imbalance. One and other condition, they are all interconnected and interrelated. So this is one of the commonest problem which has to be addressed and treated. So we should not hesitate saying, okay, we are not yet married. Once after start of the menstruation, around 3 to 4 years, we have to wait for the hormonal axis to develop properly and wait for the regularization. We should not jump right away after onset of the menstruation to correct the cycle irregularities. We should always give time for the regularization. Then once the girl crosses 16 to 17 years, still the cycles are irregular. We can notice the changes in her. Then we should start correcting. One is either by medication or by the lifestyle changes. It can be healthy lifestyle, healthy food habits, all these things. And then we should not wait for the girl to get married. Okay, now it is common, let her get married. If in future she is not able to become pregnant, then we will address the issues. Like that, we should not wait. We should always address the problem at the earliest with a simple means.
Thank you, Doctor. You almost encompassed today's topic. Now, Dr. Janvi Asantula, your short take, or if you want to add anything to what Dr. Anita said, please.
Sir, like Dr. Anita said, it is very important to know about PCOS because most of the patients which we see here in our clinics nowadays are PCOS. 8 in 10, that is what she said. That's absolutely correct. So, and it is very easily treatable. And one thing most of them forget is it will have a long-term consequence. Okay, it is not just short term. We cannot just think about only infertility part, only fertility issue. Now it is solved. Now she has a kid. Now she's getting rid of PCOS. It doesn't work like that. It is a syndromic disease. So we have long-term consequences like more risk of diabetes, that is sugar, more risk of having irregular lipid metabolism. So they are more prone to diseases which are like cardiovascular diseases. They are more prone to have depression, anxiety, psychological effects. Towards the end stage of life, they are also more prone to endometrial cancer because their endometrium doesn't bleed for many days together. So all these have to be addressed, not just the infertility part. I feel that is also very important, and their quality of life is also a little bit decreased because of this. They will have acne, unwanted hair in adolescence. So their quality of life and their long-term consequences should also be kept in mind while treating PCOS.
Thank you, Doctor. Dr. Janvi, there's a question for you. This has been asked by one Manjushri.
Yes, sir.
She's been asking, PCOS, does it affect the egg quality, madam?
Yes, it does definitely affect the egg quality. When we are looking at eggs, we are looking at different things: egg development, egg release, and egg quality. Egg development, all these three are affected in PCOS. Egg development is affected because there are too many eggs and our body hormones will not be sufficient to develop all of them. So none of them is selected and no dominant follicle. That is usually 1 month, in 1 month we'll release one egg. So there is no selection of that egg and that egg does not grow. So egg development, egg release is also affected. And in PCOS, there are more male hormones in our body. That is why we see acne and we also see this unwanted hair development. All these are there. So when there are more male hormones, especially in the ovary, all these male hormones are also produced in the ovary. So egg which has to be developed in more of estrogen conditions, it is developing in more of androgenic conditions. So there are definitely egg quality issues which are there. So when you compare an egg quality, when you compare results, like for example, in an IVF from a non-PCOS woman to a woman who has gross PCOS, definitely women who do not have PCOS will have a better quality egg and results as well.
Manjushri madam, I think you have got your question answered by Dr. Janavi. Now I would be asking question to Dr. Anita madam. Madam, can PCOS or PCOD be avoided? Anita madam.
Yes, sir. As I already told, it's like, can we avoid means, yes, we can control the condition, like by healthy habits, healthy food style, healthy lifestyle, and healthy habits also. Like have a proper diet, like more of fruits and vegetables, less of junk, like how the present generation, like all of us are behind the fast foods, let it be pizzas, burgers, or whatever easily available and tastier foods. So instead of that, go for more of fruits and vegetables and healthy food. And other than that, healthy lifestyle, like at least minimum of 1 hour exercise per day should be in the calendar, in our daily, like in our daily calendar. So this will definitely help to control our weight. And stress, see, it's easy for us to tell avoid stress, but how to avoid stress, that is in our hands only. Like divert yourself, do something else like meditation, or like reduce the working hours. Like for example, present day all software engineers, they are in front of the system. As soon as they wake up, they'll be in front of the system, and late night sleeps, and reduced sleep hours. So because of this, more of carbonated drinks, more of alcohol, smoking, more of junk food. So all these things without exercise, because whenever that, we get time trying to sleep only in odd hours, instead of giving importance to the like working, like aerobics or exercise. So all, if we practice healthy lifestyle, then definitely we can control the PCOD conditions. Instead of definitely we can avoid also. In that way, we can prevent it. Once we get the PCOD, we have to control it by either the other methods and the medications. It's difficult to cure the PCOD.
Thank you, madam. Dr. Janvi, next question is to you. Can one have regular cycles and still have PCOS?
Yes, sir, that is definitely possible, because when we are talking about routine symptoms of PCOS, we are talking about irregular cycles, and we're talking about more of androgens. That is, either blood test shows more of androgens, or the patient has more of acne and unwanted hair on her chin, upper lip, and breast, or our scan can show polycystic ovaries. So there are different variants of it. They can occur in many permutations and combinations. So patient can have regular cycles, can be very thin. They can have normal ovaries and also have hyperestrogen. All these conditions can occur in different variations. So a patient who has severe acne and severe unwanted hair, along with her ovaries in the scan appearing polycystic, she is still a PCOS patient. Though she is having regular cycles, all the other effects of PCOS will definitely be there for her. So it is possible to have regular cycles at a PCOS as well.
Thank you, madam. Dr. Anita, what are steps involved in diagnosis of PCOS or PCOD?
So it's like, see, normally, regularly patients walk into the OPD asking whether I'm having PCOS. Ma'am, I am already, they know, they would have diagnosed I'm having PCOS. So many people, I think many people of the younger generation, they know that PCOS means how to diagnose. So basically from the history itself, like as Dr. Janavi said, they can be regular or irregular cycles. If at all the patient has irregular cycles, that is one thing. And weight gain. A patient with PCOS can be thin, like normal weight, or it can be obese also. They can be obese also. So either obese women, and then or people who are going obesity is there, still they're trying like more than 1 or 2 hours they're trying to exercise, still not able to reduce the weight. So that means the PCOD is not letting them to lose weight also. So that is one thing. Weight gain, or not able to lose weight instead of even the workouts. And other thing is on by physical examination, like madam said, like excessive hair, oily skin, acne, unwanted hair, all these things. And by biochemical, like blood investigations, to check whether any abnormal rise in the certain hormones. It can be male hormones called androgens, It can be other hormones also. And one is by ultrasound. Presence of excessive cysts, that is bubble-like appearances, follicles, we call excessive follicles in either of the ovaries. So all these parameters we consider, at least 2 parameters should be there to diagnose them as PCOD, either irregular cycles or ultrasound features, or weight, excessive weight and ultrasound features, or some other metabolic like excessive androgens, hormones with another feature. So at least 2 parameters, if they are there, then we call them as PCOD patients.
Thank you, madam. Dr. Janvi, next question is to you. Is taking treatment necessary to get pregnant if one has PCOS?
Yes, sir. I would definitely say, if generally asked, definitely yes, sir. Because in PCOS, when we are talking about how the disease progresses, how the disease occurs, the main pathology lies in the ovary itself. Ovary has a lot of eggs. Ovary has more number of eggs which are not growing. So ideally, one of them have to be selected and one of them has to grow. Around 14th or 15th day of her periods, the woman has the egg release usually. So since this is not happening in PCOS egg release is not happening, egg development is not happening, definitely she will need some help. Some additional dose of low dose hormones will definitely help us to increase the fertility rates. There are many people who have PCOS and who conceive also naturally. It is not like they will not conceive totally, but the chances of pregnancy are very less. When you talk about patient who have PCOS, occasionally she can have 1 or 2 egg releases in a cycle, in the middle of her cycle. It can occur randomly. So proper egg release is definitely not there. So if you want to increase the chances of pregnancy, definitely treatment is necessary for a PCOS patient.
Thank you, madam. That was a precise answer from you. And Dr. Anita, next question would be, can home remedies help in dealing with PCOS and PCOD?
That's what we've been talking since then actually. Home remedies means change in lifestyle only, basically. Other than that, I cannot say what, like Ayurvedic or native treatments, whether they help or not, I'm not sure. But definitely losing weight, healthy lifestyle, healthy food habits will definitely allow us or make us control the PCOD.
I'll add another question to that, madam. Is there a cure for PCOS?
That also have answered, sir, already. There is no cure as such, but we can control the condition with our lifestyle only. That is one thing.
Sir,
and
yes. Sorry, ma'am, please go on.
Yeah. Dr. Janvi, you add.
Yeah, Janvi, please.
If I can add, this is one of the common questions asked by the people who come to the clinic. Once we diagnose with them, diagnose them with PCOS, next month, after 1 month of treatment, they'll come and ask, "Madam, is my PCOS gone or is it still there?" Sir, patients, I am trying to make you understand that it doesn't work like that. PCOS is like diabetes or hypertension. You will have to work on it daily. You will have to keep your lifestyle modifications. You will have to keep exercising, maintain your diet. Only then it will be under control. It's not going to go. So it is definitely going to be there once PCOS comes. Once we are diagnosed with PCOS, then it is definitely not going to go. So we can exercise, maintain our lifestyle, diet, weight reduction can be tried, and we can keep it under control. And if at all we deviate from our discipline, again, it's going to come back. So that is how it works. And like Dr. Anita said, it's always better to go for preventive measures than curative measures, because once PCOS is there, it is there. It is not going to go.
Okay, madam. Thank you. And now next question will come to you, Madam Janvi.
Yes.
What would the long-term effects of having PCOD be?
Yes, sir. This is also a very good question, because when a patient walks into the clinic, both the doctor and the clinic, both the doctor and the patient are mainly concerned about the short-term effects. Very rarely people look at the long-term effects of PCOS. Long-term in PCOS, they can have more risk of having diabetes, more risk of having lipid abnormalities, that is their lipid metabolism is altered. So their fat is, what can I say? They have more amount of bad fat and less amount of good quality fat. So that is also harmful. They are more at risk of having cardiovascular diseases. They are more at risk of having endometrial cancers. They are more at risk of having psychological effects like depression and anxiety. They are more at risk of having something called obstructive sleep apnea, where because of the fat around the chin and the neck will alter their sleep pattern. So they'll not be able to sleep properly in the night. So they can have a disturbed sleep pattern, more of snoring in the night. That is usually the complaint of the patient. So they will have more of snoring and they'll not be able to breathe properly. So they will have inadequate sleep in the night and they will still be sleepy in the morning. That is also one of the long-term effects of PCOS. And they will have more of insulin resistance also. So they can have darkening of skin around this neck, around the in the axilla region, and also between the thighs. So these are all the long-term effects of polycystic ovarian.
Thank you, madam. Dr. Anita, can IVF or ICSI help a PCOS woman to conceive?
Definitely, yes. See, if a patient is diagnosed with PCOD and she is having subfertility or infertility, she needs medical help. But if by corrective measures like weight losing tendencies, all these things usually resume spontaneous ovulation and they will conceive naturally. If this is not happening, if the patient's age is more, married life is more, and they have tried all other lower measures to conceive and it's not happening, we have to go for the higher measures, that is induce ovulation. And as Dr. Janvi mentioned in the beginning only, the egg quality will be definitely compromised in the PCOD patients because of the androgenic hormones. So in such cases, going for IVF, taking the eggs and seeing them under microscope and visualizing the quality of the eggs and fertilizing by ICSI method, that is injecting each egg by each sperm separately under vision, which is under our control, and making them grow. So by this method, that is IVF ICSI, we will come to know what is the quality of the egg, quality of the sperm, and quality of the embryo also. So in such way, good quality embryos will be selected and these embryos will be transferred to the patient, and this will definitely help them conceive. But if they again, not only the egg and the sperm and the embryo, there is one more factor, that is the endometrium, that is the lining of the uterus, which also dictates the pregnancy. So that also has to be well controlled. In PCOD patients, there will be chances for endometrial hyperplasia. That means the patients will go for thickening of the endometrium. So this endometrial hyperplasia won't allow the embryo to grow, to attach and grow, implant and grow. Implantation failures will be high, though the embryo quality is good. So such patients, definitely they have not only, they should depend, okay, now we have gone for IVF, so we will conceive now. Like that, they should never think. They should continue with their other measures from their side. Like doctor will definitely give medicines, other measures, we can only help. But from patient side, they should control this androgenic environment in the body. That is, androgen hormones can be controlled by exercise only, by losing weight, healthy food habits. So once this is controlled, the endometrium lining also will be improved, blood supply will improve, and the implantation rates also will increase. Once the pregnancy occurs for this PCOD patient, the chances of continuation of pregnancy also problematic. They'll go for either anembryonic gestation. That means only the pregnancy sac will be formed for these patients. The embryo only, the baby only won't develop. Or if develops also, they might go for early pregnancy losses, that is abortions, again because of the hormonal imbalance in the body only. So such things are more common, like recurrent pregnancy losses, either implantation failures, abortions, and then in future preterm labors, all these things. So to avoid all these things, from the beginning, from step 1, 0 day, we should start on working. One is doctor will help from their side. We also should work from our side.
Thank you, madam. Dr. Janvi, is laparoscopy always necessary for PCOS patient while trying for pregnancy?
No, sir. Laparoscopy is not always necessary for a PCOS patient. The idea behind laparoscopy is for somebody who is not responding to routine hormones, routine tablets which we are giving for egg release. The idea behind that is to decrease the number of eggs which are already there, to decrease the cells in the ovary which are producing androgens. Okay, that is called to decrease. So totally we are going to destroy the androgens producing cells in the ovary. So that is the idea behind it. But if at all the patient is having egg release with a routine protocol, that is routine oral medications and routine injections also, gonadotropin hormonal injections, it is not always necessary for a patient of PCOS to undergo laparoscopy. Laparoscopy may be done for other indications like checking the tubes or checking in the presence of endometriosis also, which is also has an association with PCOS. But just for PCOS, if a patient is not conceiving, without trying any other medications, we are not justified to go for directly laparoscopy, and it is not always done also.
Thank you, madam. And for today, we have only that much of time, but I would like to ask Dr. Janvi to conclude. If at all you would conclude today's talk, how would you do it?
Sir, when we look at the disease progression of PCOS, we rarely heard about the disease when our professors were in medical college. It was a very rare disease and it was not seen often. Now, when we started studying medicine, I could see that there was a lot of change. There was a lot of increase in incidence, that is, a lot of increase in the number of patients of PCOS. Mainly, it is because of our lifestyle, our food habits, and our sedentary lifestyle, and a little bit of genetics also. So definitely prevention is better than cure. I think from whatever we are seeing in our generation, it's already done because the adolescent phase is crossed. When we are thinking about preventing PCOS, the actual step starts from adolescent age group itself. When they are in around 10th class, 12th class, that is when the disease progression starts. And because of our education and because of our ambitions, there is a lot of stress on kids these days, which also increases the sedentary lifestyle. They hardly play outside, which also they're also having a little bit of bad food habits also, which also increases the PCOS. So definitely when we're thinking about preventing PCOS, which is the best way, because there is no absolute cure once you get it, we can just put it under control. So when you are thinking about preventing the PCOS, a girl who is in adolescent, who has just started menarche and who is just having irregular cycles, you can get her checked. You can alter her lifestyle so that she is not getting PCOS itself. So prevention is always better than cure. I would conclude definitely by saying that.
Okay. Thank you, madam. Dr. Anita, would you like to add something to that? Or
already madam has told everything.
Okay.
But only one point I want to stress again is, don't try to treat PCOS only for kids' sake, like for fertility's sake. As madam already told, fertility is not the only issue. There are long-term complications, as Dr. Janvi already mentioned. So not only for looks or for the fertility issue, please concentrate on PCOD and healthy lifestyle for health's sake. That is one more point I want to just stress upon.
Thank you, madam. Dear viewers, that's all we have time for today. I would request you to write in the comment box if at all you need our subject experts to talk on any particular topic. Please, the choice of your topic would be mentioned in our comment box. Next time we will take that topic up. Thank you, doctors.